Light shine, boys, and send the specimen to Nurse Ratchet.
As depicted in the 1975 film One Flew Over the Cuckoo's Nest, before modern psychiatric medicine became available in the 1960s, treatment for mental illness was extreme.
Here we go.
The bad old days continued up till probably the late 50s, early 60s in this country.
But then a new medication emerged that transformed the field of psychiatry. This new drug had a unique calming effect that would make patients tranquil but not drowsy or sleepy, and over time the medication would reduce the serious symptoms of psychotic illness, like hallucinations. This drug's name was Thorazine.
And it was truly revolutionary. I mean, the people had never seen anything like this before.
Suddenly, doctors had a far more effective way to treat mental illness, and it allowed patients to be treated outside of institutions.
The impact on the clinical care of these people was changed really dramatically. And it meant that you could be more optimistic about getting people rehabilitated and getting them out of the hospital and back to their families and real life.
Doctors were highly optimistic about Thorazine curing the mentally ill, despite severe neurological side effects such as tremors and twitches.
There was a temptation to use the drugs with a very heavy hand.
By the 1960s, there was a movement to close all public asylums. This movement was called Deinstitutionalization.
The deinstitutionalization would not have happened without the development of the antipsychotic drugs.
While drug therapies have been effective, patients still need a lot of other types of therapeutic support.
I mean, stuff like taking care of people, talking to people.
But now most of the long-term hospitals that provided some of those supports have closed.
Because there's a pressure to get them out of the hospital, oftentimes medications are increased faster than they should be.
While deinstitutionalization was a progressive move for treating the mentally ill, patients who needed the extended hospitalized care now lacked a place to go.
It maybe went a little bit too far. And there's a portion of the population who can't make it on the outside.
So where do patients who can't make it on the outside end up now?
Well, we've increased the size of our jails and prisons substantially. And so if you actually go and you start talking to the legal, examining the legal system, you will see that one of the consequences of the deinstitutionalization is that our patients are now in jails and prisons. And so they're getting the long-term care, it's just at a different facility.
The landscape of treatment for mental health patients has progressed greatly since the days of shock therapy and lobotomies. Thorazine has had a significant impact in this advancement, but sometimes something positive can have unintended consequences, and we still have a long way to go.
What do you think you are, for Christ's sake? Crazy or something? You're no crazier than the average all out walking around on the streets.